Hello, you guys. My name is Haley, and I will be doing a presentation over bipolar and related disorders. For this slide, I want to talk about the DSM-5-TR, which stands for the Diagnostic and Statistical Manual of Mental Disorders. This manual is published by the American Psychiatric Association and is one of the most trusted resources used by mental health professionals. It provides the official diagnostic criteria for disorders such as bipolar 1 and bipolar 2 disorder and other related conditions. This also explains the symptoms a person must have, how long the episode lasts, and how severe those symptoms are. The purpose of the DSM-5-TR is to create a standard system so professionals can accurately diagnose patients. This source is considered reliable because it is based on extensive research and expert review. It focuses on clinical accuracy rather than opinion. For the next slide, I use this information from the National Institute of Mental Health, also known as NIMH. This is a trusted federal research agency that provides evidence-based information about mental health disorders. According to NIMH, bipolar disorder is a serious but treatable mental illness. It involves major changes in mood, energy, and behavior. People may experience mania, hypomania, and depressive episodes. Mania involves extremely elevated mood and high energy, while depression can cause sadness, low energy, and loss of interest in activities. NIMH also explains possible causes of bipolar disorder, including genetics, brain structure, and chemical imbalances involving neurotransmitters. Risk factors can include family history, substance abuse, or traumatic life events. This source also emphasizes treatment, a combination of medication such as mood stabilizers, therapy, cognitive behavioral therapy, whatever is best for that patient. It is very effective as well. And I choose this source because it is reliable and it's easy to search up and find more information on. So I think this will be best for helping people understand and manage bipolar disorder. This slide, I use this information from the World Health Organization, also known as WHO. This organization looks at bipolar disorder from a global public health perspective. According to WHO, bipolar disorder affects people all around the world and creates serious challenges in daily life, work, and relationships. It can also contribute to disability when symptoms are not properly treated. The WHO highlights the importance of access to treatment, early intervention, and reducing stigma surrounding mental illness. Many people around the world face barriers to care, such as limited mental health services, lack of resources, or discrimination. Unlike sources that focus mainly on diagnosis or treatment in the United States, the WHO emphasizes worldwide disparities and the need for stronger mental health symptoms. I picked this article because it is highly reliable and based on international research and expert collaboration. This can help, people with bipolar disorders, and it's also a global health concern as well. This slide, I use a article published in the Lancet, which is one of the most respected medical journals in the world. Many people use this article. This article explains that bipolar disorder is usually a chronic recurring condition condition, meaning it often requires long-term treatment and regular monitoring. Many individuals experience repeated mood episodes over time, so ongoing care is very important. The source also discusses several major topics, including genetics diagnosis, neurobiology, and medical treatments. It helps explain biological factors and the brain functioning may play a huge role as well. But compared to more general sources like the WHO or the NIMH, this article is more technical and research focused. It is mainly written for clinicians, psychiatrists, and researchers. I choose this source because it is highly reliable and it is useful for understanding bipolar disorder from a scientific perspective. For this slide, I use a study by Marikangas, if I'm pronouncing that correct, and colleagues that examined the prevalence of bipolar spectrum disorders in the United States. This study was published in a respected peer-reviewed journal, making it a reliable source. The main finding was that bipolar spectrum conditions may be more common than previously recognized. This means that more people may experience symptoms of bipolar disorder than early estimates suggested. The study also looked at the demographic differences, such as who is affected most often, along with the impairments bipolar disorder can cause in daily life. These impairments may include problems with relationship, work, school, and overall functioning. Unlike sources that focus mainly on diagnosis or treatment, this study focused on epidemiology, which means how common the disorder is and who it affects. I choose this source because it is helpful and it helps us have a better understanding of the real impact bipolar disorder has on individuals and society. For this slide, I use information from Getty's, who focus on treatment and long-term management of bipolar disorder. Their work explains that successful treatment usually requires a combination of strategies rather than only one approach. They emphasize the importance of taking prescribed medication consistently, attending to therapy, involving supportive family members, and maintaining healthy daily routines. These routines can include regular sleep, stress management, and avoiding substance abuse. This source also discusses recognizing early warning signs of relapse, preventing future mood episodes, and improving communication within family and relationships. Compared to highly technical journal articles, this source is more practical and easier for the general public to understand. I choose this one because it shows that managing bipolar disorder is often a team effort and that long-term stability is possible with proper support and treatment. This slide, I use another article by Getty's, and it was published in the Lancet, which focused specifically on treatment strategies for bipolar disorder. This article explains that the best long-term outcome usually comes from combining medication with psychotherapy. Medication helps stabilize mood and reduce severe symptoms, while therapy helps individuals manage stress, recognize triggers, and build coping skills. The article also emphasizes relapse prevention, which means reducing the chances of future maniac or depressive episodes. I choose this source because it is evidence-based, reliable, and shows that successful treatment often requires both medical and psychological support. This slide is about the National Alliances on Mental Illness, NAMI. This provides an educational material about causes, symptoms, and support resources. The main point of this article is that bipolar disorder is manageable with the right treatment and community support from family, friends, and physicians. It also includes warning signs, family education, and coping tools. And I would refer this to someone because it explains how the bipolar disorders are, and it also promotes support as well. Compared to the NIMH, it focuses more on the lived experience and family guidance. While it is advocacy oriented, it relies on medically accurate information. So I think that would be a good slide as well, well, article to look back on. This article here is the American Psychological Association. It provides information about the psychological aspects of bipolar disorder. The main argument of this is to emphasize the importance of therapy, behavioral interventions, and early intervention. Topics include mood regulation, psychotherapy approaches, and comorbid conditions. Furthermore, the main argument of this article highlights the importance of bipolar disorder having psychological treatment, such as improving overall functioning. Compared to the DSM-5-TR, which focus on diagnosis, this source emphasizes therapy and coping strategies. As a professional organization, the information is reliable and research supported. It is objective and educational, aiming to inform both professionals and the public. Overall, the goal is just not to define bipolar disorders, but it is to help promote effective treatment, reduce stigma, and highlight the stability that is possible with proper psychological support. This article is by Johns Hopkins Medicine, provides a clinical overview of bipolar disorder, including symptoms, diagnosis, and treatment planning. The main argument in this article is that early diagnosis and consecutive treatments result in significantly by better outcomes. The topics in this article includes the type of bipolar disorder, risk factors, and medical management. If I were to give this information to someone about this article, I will let them know that this source explains bipolar disorder in a medically practical way for patients and families, whoever is need this information. Compared to the journal articles, it is less technical but still evidence based. As a student who is learning this, it is highly reliable and objective. It is a goal patient education rather than advocacy or research publication. This resource is less dense and more accessible for those to access it, but it still relies on evidence-based medical knowledge. Lastly, since it comes from a respected academic medical institution, the information is highly reliable and objective. Its primary goal is patient education, helping people recognize symptoms, understand treatment options, and feel empowered to seek and continue care. And this is my reference works cited with all of the pictures that I posted. And I also have my APA works cited information as well on my form. But overall, I think this is a good presentation to look back on, to do some research on. If someone has a family member who is going through bipolar depression or any type of related problems, health problems, I think this will be something to look at, something to refer to, because it has a lot of information, a lot of good resource for people to learn on what goes on in the mind overall with whoever they're dealing with, or just simply for themselves. But I do think this will be best for someone to look over. And that is all, you guys. So thank you for watching my PowerPoint. And also, bipolar disorder is very serious, is very common in the United States, so I think this would be best to watch and see. Thank you.